How can you prevent yourself from getting pregnant as a single lady or as a married woman? Maybe because you are okay with the number of children that you have now and you don't want to have any other children again, you don't want to get pregnant again. Is what we call family planning. So you can still implement it as a single lady, maybe because you are not ready of becoming a mother now. So you want to protect yourself until you are ready to get married and become a mother. So you can also go through this process. So when it gets to this stage, a lot of married women or a lot of single sisters get confused. Most people don't actually know what to actually do. So I'll be explaining some of the methods you can use to actually prevent yourself from getting pregnant. So I'm not doing this alone. All of us we are doing it together. So if you are a married woman here or a married man here or even a single lady and you are watching this video and you have other better options, I will want you to put it in the comment section so that all of us can learn together. We can actually help ourselves. Click on the like button, share this video so that to get to as many people as possible so that all of us can actually learn together. Now, I have about 10 methods I want us to talk about. The number one method is what we call your vaginal ring. Some people even call it coil. It's a type of contraceptive method that can prevent you from getting pregnant. So how does it actually work? You will buy it and you will insert it inside your vagina and you leave it there for about 21 days. So you can go and see your doctor. The doctor will explain it to you how you can use it properly. So after that 21 days, you will remove it and you will stay like that for about 7 days. So that 7 days is when you might have some bleeding. So after 7 days, you put a fresh one, a new one. You insert it again. You leave it there for about 21 days. After 21 days, you also remove it. That's how you'll be doing it every month. Although you need to see your doctor because this approach, this method does not actually work for every woman, depending on your health condition and your scenario at that particular time. Maybe you are breastfeeding, maybe you have some health issues, so your doctor will have to first of all examine you to see if this method will work for you. So and this method have about 99% guarantee if you can do it properly the way your doctor explain it to you. Why most women will tell you that this method fail them is because maybe when they removed it after that 21 days, they forgot to put it after the 7 days. You can just forget, maybe you skip 1 or 2 days, you forgot, and in that process you now meet your husband. Before you now remember, I rush and go and put it. By that time it might be too late. So that's one of the reasons why it fails a lot of women. So that's one method. The number two method is what we call condom, which most of us are conversant with. And we have two types of it. We have the male condom and we also have the female condom, which you can get from your pharmacy. So when you want to meet your husband can decide to wear the male condom. But if your husband don't also want to wear the male condom, you as the woman, you can decide to wear the female condom during when you want to actually meet. So this process actually have 98% assurance that you don't get pregnant, except there's a damage during the process. Maybe it got broken, it got tore. So that's the only way you can actually get pregnant through this means. So this one is anytime you want to meet your husband, either of you can decide to wear it. The third option is what we call the contraceptive pill. It's a type of medicine you might be drinking every day. And it comes in two types. We have the combination pill and we have the progestin only pill. It depends on your situation. That is what will determine the one your doctor will write for you. Some women are breastfeeding, some women have some health issues, some women have one or two sickness. So your doctor will not determine which type you can take out of these two. Now there are some that you will take for about 21 days. After that 21 days, you will stop. Then in the next 7 days, they will give you another type to take. So you'll be taking that type for that 7 days. So it is during that 7 days you might see some bleeding and all that for that 7 days. So after that 7 days, you start taking the other one again for 21 days. While there are some you only take it for 21 days, in the 7 days you will not need to take anything. That's when you also see some bleeding. Then after that 7 days, you will start taking it again. While there are some you have to take it for about 91 days straight. Every day you'll be taking it every day. Then you stop for about 7 days. That's when you also see some bleeding. Then you start again, take it for another 91 days. You will stop for 7 days. You start again. So that one is dead. There's another one you can actually take for about 365 days. So it is you and your doctor that will not determine the one that will be best for you, depending on your scenario and depending on your agreement with that particular doctor. although some of these ones still have their own side effects. So those of you that are watching me now, if you are conversant with any of these ones that I've listed here, you can also put your experience in the comment section and also make your contribution. This is just for tutorial purpose, educational purpose. I am also learning. Those of you that are watching me, all of us, we are learning. So if you know better, you can put it in the comment section. Now it depends on how this particular video flies. So if this video go viral, I'll be encouraged to do the remaining 7. So I will just leave you with these 3 methods. So depending on how this video go, I'll be encouraged to also post the remaining 7 methods on how to prevent yourself from getting pregnant, either as a single lady or as a married woman. Thank you and God bless you. And make sure you share this video. Thank you.